Hey there, welcome to the Jewish Adulting Podcast. Thank you for joining me today on your adulting journey. Before we get started, can you do me a quick favor? Can you hit the like and subscribe button on whatever platform you're listening to this? I promise it's not a lifetime commitment, but when you don't subscribe, it's kind of like coffee without caffeine. What are we even doing here? Or like latkes without applesauce? Are we even living our best life? When you subscribe, you not only give me warm, fuzzy feelings, but you're also helping me bring amazing guests who rely on subscriber counts to know whether joining me is a worthy endeavor. More subscribers mean more epic conversations for you. And hey, if you're feeling extra generous, you can also show your support by becoming a monthly supporter at buymeacoffee.com/Jewish adulting. Whether it's $1, $5, $10, or even $20, every little bit helps make this podcast rolling. Of course, if you're sitting on a cool million or even looking to sponsor the show, reach out to me at jewishadulting@gmail.com. Also, I'm always looking out for engaging, thoughtful, passionate guests to join me. So if you want to nominate someone or want to come on the podcast yourself, reach out. Let's make a podcast shidduch.
This is Rabbi Ben-Zion Schaefer of the Shmooze.com. Jewish adulting is about shining a light on parts of ourselves in order to do Avodas Hashem with all the tools and resources at our disposal. It is an honor and a privilege to have every day to further refine our character and grow closer to Hashem. Take advantage of these opportunities before it's too late.
Hello, everybody. This is Chadva Rose, your Jewish Adulting podcast host. I am here today with Dr. Marcy Forta. And Dr. Forta is actually has an MBA in leading and is leading authority on eating disorder education, awareness, and prevention. So I actually had the honor of going to one of Dr. Forta's classes or lectures, which she gave out through one of the local schools. And I saw that she was coming, and I already knew that this would be a great opportunity to speak with her. And so I brought her onto the podcast. She graciously agreed to join me. So thank you so much for being here.
Thank you so much for asking. I'm excited for this conversation.
Yeah, great. So I am too. I always have fun when I do these. And so I hope it's fun for you too. And I hope that you appreciate what I don't know and that I'm asking the questions. But tell me a little bit about yourself. Tell me about, what led you to sort of start this organization, Atzmi, to write the books. You wrote a book and on this topic about, specifically focusing on risk factors of prevention of like eating disorders and body dysmorphia and all of that. And so tell me how that came to be.
Okay. Well, I actually used to run a women and girls sneakers clothing store in Michigan, where I'm from. And I did that for about 16 years. And what I noticed really was that, and this was day in and day out, it wasn't on occasion, truly the struggle of the young girl, becoming a young woman, her body changing, her feeling very uncomfortable in her body, not knowing how to relate to her body, how to dress her body, the struggle of the young woman becoming a young mother, feeling very uncomfortable in her changing body, as well as the struggle of women going through later life phases and changes, and feeling uncomfortable in their bodies. Everyone really struggled. That was kind of a universal theme that went throughout. And so when I sold the store kind of for personal reasons, I just kept thinking about all these people who are struggling, and it really affected me very profoundly, I guess I would say, because it was something that I related to intimately as someone who struggled with or grappled with my own eating disorder as a teen. And so while not everyone who struggles has an eating disorder, of course, the struggle is universal. Obviously, an eating disorder is one spectrum. But I felt like, well, Baruch Hashem, thank God, I was able to recover from mine. Not everyone is as fortunate. Eating disorders are very complicated, dangerous illnesses. And I just felt like we needed, that almost Hashem was speaking to me in a way that we need to find better ways to head off these devastating illnesses. There has to be a better way. And so that's when I actually went back to school and did my doctorate in educational leadership with an emphasis in behavioral health. And really, my research focused on the unique risk factors that we are seeing in the Jewish Orthodox female community. What are the issues that we're facing for eating disorders? And then I took the time to be trained in the secular eating disorder prevention programs that exist out there so that I would understand, how they work, why they work. And then I really decided to create what we call the My Best Self Project, which is curriculum for our girls in schools. It's a Torah-based curriculum, but it is also empirically based, and it works to increase self-compassion, self-esteem, emotional regulation, body image, and works towards the prevention of eating disorders. Part of what we do are also seminars for mothers, and that is kind of why I wrote my book. We know that moms are such a huge influence in how a daughter perceives and looks at herself, her image, her body image. And a lot of mothers, struggle with their own issues with their own bodies, and they really wanted a way to help their daughter. And they know that modeling is a huge way that girls look up to and see, their mother's relationship with food and their body and how they talk about themselves. So I wrote the book really to talk to moms. It's called How Can I Help My Daughter? A Mother's Guide to Nurturing Her Daughter's Best Self. And it's really, yes, it talks about eating disorders and signs and symptoms and some causes, but really it's more about what we can do and helping ourselves, that will go to the next generation.
Right. So I was telling my sister the night that I came out to see your lecture at the school, which I was really grateful that the school was even having a conversation about it, because I think that many years ago that even the conversation would have been like taboo, and we're not talking about it. We're not acknowledging this as a problem. And we'll get to that in a little bit. I have some questions about that. But I said to my sister, like, oh, I went to this class about, helping our children with their body image. And she said, oh, yeah, what did you learn? And I said, I learned that I did everything wrong. And, and it's too late for me. And go on without me. But there is, I know I'm on one hand, like parenting classes is for like the young parents many times. I find that, if I had if there had been an openness to discuss this, when I would not, first of all, it's not just that if there had been such a program, but would I have attended? Would I have thought, well, this might impact me? Is this relevant to me? Do I need to go see this? Do I have time to go to this class? Like, I'm not 100% sure. People say, oh, if it had been available, I would have gone. I don't know if that's true. If we're being completely intellectually honest about that, but I think that there are different things we could talk about depending on the age of your children, whether you like my children are teenagers at this point. So like any damage, like maybe I didn't work on my eating issues and now they have unhealthy eating, so obviously that's a different Parsha than, when you're still in the phase where you could control your kids' eating in a way, and you do make the decisions about what to bring into the home and all of that. So what do you say to that?
Well, first, I'd like to say it's never too late, by the way. I don't want people to feel that it's ever too late or that I ruined everything. We can always make changes wherever we are, whatever age and phase and stage that we are with our families. That's number one. And number two is, if we look at body image, yes, how our mothers model their behaviors and their feelings about their bodies definitely impacts us. But there are other parts to how our body image is created that don't have to do with, our relationship with our parents or that, society or our experiences with weight stigma or just in general, our culture, diet culture, our peers, what they are saying. So there are a lot of pieces to it. And I really feel strongly that whatever age and stage our kids are at, that we can work toward having better conversations and better ways of talking about these things, less guilt and shame, less, severe stances on weight and health and understanding, the construct of health and what it is. So I always feel there are things we can do.
Right. So actually, let's get into, some obstacles towards normal. I guess I don't even want to know if I want to use the word normal, but, healthy ways of looking at your body. I think when you were speaking at the lecture, so I have the benefit of having attended. Those are always better. any topic where I've actually gone to the lecturers speeches before, I always come a drop more prepared because I tried to take notes. But you mentioned that 75% of girls are dissatisfied with their bodies. Is that first of all, that's an alarming number, but not that surprising. So my question to you is this something that is seen in greater numbers in the frum community? Like, do we follow the trends of the secular world? Is this number, do you know anything about this number?
So that number is actually over 75%, and that's during adolescence. And that number tends to grow as we go through young adulthood to well over 80%. So it is kind of surprising. As far as body image struggles, what I can tell you is where we sit as far as eating disorder incidence and onset. I don't think we deviate from the norm as far as body image issues go, but as far as eating disorders issues go, we are up to 2 times more likely to struggle with an eating disorder than the general secular world. And there can be, several reasons for that, but the numbers actually show that between 9 and 12% of people in the United States will be diagnosed with an eating disorder in their lifetime. And 95% of them will be between the ages of 12 and 25 during their diagnosis. And if we, Jewish women and girls, are up to 2 times more likely, that means between 18 and 24% of us could struggle with some, shape or form of an eating disorder in our lifetime. And those are very big numbers.
Yeah, it is. And it's even more surprising when you think about Judaism's sort of emphasis on the panemius, on modesty, on the soul as the most important part of our existence, and yet here we are talking about a very fundamentally Gashmias type of problem of body image and the way that we look, and how do we reconcile the fact that this is such a issue in the frum community?
So that's a very loaded question. It's a good question.
Mm-hmm.
There are a couple things to think about. Some of the studies have shown that when people have a more internal connection to religion, to God, their God, Hashem, our God, that will be a way to kind of ward off an eating disorder. That will help in the prevention of, and even in the recovery from an eating disorder. So that means when I talk about an internal connection, that means that they have their own unique relationship with Hashem. They've solidified a relationship. They feel connected, and they feel like they really have a true, deep relationship with Hashem. Whereas when people have an external relationship with Hashem, they might still be frum, but they don't feel connected. They've been told how they have to do things and what they need to do, and they don't yet have their own connection with Hashem, and that makes them more at risk for either, the development of an eating disorder or other types of mental health struggles, or more difficulty in recovery from an eating disorder. But that said, I think one of our biggest issues is that push and pull that we have, because while we know logically, like you said, that our relationship with Hashem, what we do, how we live our life, what's on the inside that really matters, and that's kind of what we verbally teach our children, sometimes inadvertently we model or reinforce the importance of what we look like on the outside as being the primary way to measure our value. And usually I'll give the example of asking people what they say most to people when they see them and they haven't seen them in a little while. Maybe they met them in shul, maybe they meet them in the market, maybe they're, at the grocery store or whatever. And generally what we tend to compliment people on happens to be physical things, their clothing, their hair. Did you lose weight? Is your sheitel new? You look so skinny. They're all very external things that we tend to value and compliment people on, especially for younger children. You look so beautiful. Your dress is so cute. Your shoes are so cute. Your hair looks so lovely. And so this creates a mixed message, in my opinion, of what is actually important and what we're complimenting them on. Because if they're getting compliments on things that aren't what's really important, or that's where they get the majority of their compliments, they're going to have confusion as to what is actually important.
Mm-hmm. Right. So, there's a lot of things that we take from the secular world. I think that it has come up before that, the current culture's obsession with dieting, the diet culture that exists, has permeated the frum community. the style, the style of the clothing, which tends to fit, smaller bodies and make them more, are more flattering, also has been an impact on the culture. And and it sounds like there needs to be an overhaul, which is kind of not that practical when it comes to thinking about trying to move the, trying to move this issue forward in our own day-to-day lives. Meaning I'm fighting against a $bazillion industry of weight loss and diet food and exercise culture and, like again, the clothing and the secular world and the Hamisha world. And there's a lot. So what would you say to a parent who says, what kinds of things can I do to work on, first of all, recognizing disordered eating, dysmorphia, where children are having, a hard time really understand, like seeing their bodies for what they are. What are, first of all, some signs and symptoms, and how do we start addressing that?
Yeah, I mean, definitely, there's a lot of pieces there. So I just wanted to mention, you talked about diet culture a little bit, and diet culture really is that belief that your appearance and your body shape are really the most important things you should work to, achieve, and that in your life, everything will go great and perfect, and you'll be more valuable and you'll be more respected and you'll be more successful as long as you are in a smaller body, or that you work to achieve this smaller body, right? As the idea that is that thinness, or controlling the size of your body over our physical health and emotional well-being is actually more important. And I think what happens is people sometimes confuse the concept of health with, diet culture, because they think that health, a smaller body equals healthy in all ways, and that isn't always the case. And as a matter of fact, health is important to understand as a construct that isn't just physical health, right? Our physical health is part of our health, but so is our mental health, and so is our spiritual health. So I feel like it's important for them to understand that the idea of diet culture, that controlling your body, particularly via your diet, by limiting what you eat or how much you eat or how much you exercise, is expected and the norm in a diet culture situation, but that's not, that shouldn't be the norm, and that's not an authentic way of looking at things. Our body size is determined by many pieces, which is not the question that you asked me, but I like to kind of just preface a little bit about what diet culture is. But you asked me specifically about signs and symptoms of an eating disorder.
Yeah, how do we know that this is something that, like, what are we looking for? Because it's kind of a broad thing. Like you said, it's not a disordered eating isn't necessarily an eating disorder. But regardless of whether it's clinically an eating disorder or not, the person's obviously bothered. It's obviously affecting their day-to-day life. It's obviously changing their behaviors, their possibly self-esteem, possibly, so there's so much. So if you could, define it a little bit more for us so that parents could even be aware to that degree.
Sure. Would you like me to go through the types of eating disorders that there are, or just the signs and symptoms of what a potential eating disorder could look like?
Yeah, I think that, to be honest with you, I think a lot of people know what, I think that a lot of people know what an eating disorder is. There's a lot of information out there to a large degree. I mean, you could tell me I'm wrong. I could be wrong. But I think what people don't realize is at what point should I start to get worried? What's normal behavior versus not normal behavior for a teenager? Because I anticipate that most teenagers worry about their bodies to some degree. And, most teenage girls specifically, but possibly teenage boys who are very interested in getting fit and, in losing weight and improving muscle mass. Like, there's probably a normal amount of, taking care of your body and worrying about it that exists. And then at what point does it become worrisome?
Sure. Okay. So yes, I think most people have heard of anorexia and bulimia for certain. Those are pretty well understood eating disorders. Not everyone, and my experience, has heard of binge eating disorder, ARFID, which is avoidant restrictive food intake disorder, or OSFED, which is other specified feeding or eating disorders, which are much higher. They're much more prevalent than anorexia and bulimia. And so binge eating disorder really is similar to bulimia in that you have these binges, but there's no compensatory behavior afterwards. There's just a lot of guilt and shame around those binges. And there's very strict rules around what a binge is and how often you have to have it in order to be diagnosed with this. But just to give you a high level understanding, and ARFID is actually people who have a genuine lack of interest in eating and food. They tend to get full quickly. They tend to have sensory avoidance. So they have issues with the food tastes, the taste of the food, the texture, perhaps the temperature, the smell of the food. And they also worry about a fear of something bad happening to them when they eat certain foods. They'll either become ill, they might choke, they might become nauseous, things like that. And then OSFED really is other specified feeding or eating disorder. And in OSFED, people have extremely disturbed eating habits. They have that distorted body image. They have that intense fear of gaining weight, but they're not clinically, as they don't have anorexia. They haven't met the diagnostic criteria for anorexia or bulimia, but their issues. They have severe disturbance in their food and eating and body weight and shape. So that's kind of level. We do know, that adolescents are more at risk for eating disorders than any other group, as they are really kind of coming into themselves. They're solidifying their own way of thinking about things. And so here are some questions to think about when you're trying to evaluate whether or not your child's struggle with their body might be something more than, like you said, just teen angst. Because oftentimes, by the way, a lot of people will say to me, my daughter asks me if she's fat and what should I say? And when a teen is saying they hate their body or that they think that they're fat, sometimes it's not so much about their body as it is about their feelings about themselves, and they don't really know how to express that. And so that's an important distinction that we could, talk more about after, but it's important for us to understand that not everyone who says they hate their body, A, has an eating disorder, or B, is even talking about their body image or their physical appearance. So it can be a little confusing. But I think it's important to think about if eating seems to cause this person anxiety or guilt or shame in any way. Do they seem to be not just unhappy with their body, but like the unhappiness is so pervasive and it's all they think about? Are they actively working to control their weight by restricting how much they're eating, changing their eating habits, changing what they will or will not eat? Purging in some way, which could be self-induced vomiting, but it could be the use of laxatives or diuretics or enemas or ipecac syrup, or do they over-exercise? And do you feel like their life is really dictated by thoughts of food, right? I like to share this concept of what we kind of call the mind share continuum. And it's really just to try to think about a visual about the idea that an eating disorder can really take over that person's entire brain. But honestly, even with body image issues, a large part of our brain can be hijacked, right? The more your brain is filled with thoughts of diets and calories and weight and shape and food and body size, the less space it actually has for the more valuable and important things in life, right? Like our relationships, our hobbies, our mitos, our chesed, whatever, our schoolwork. And so it's really important for us to kind of determine how much of their brain is being overtaken by these thoughts, right? Because like you said, there's a spectrum. We might have normal eating on one side of the spectrum and an eating disorder all the way on the other side of the spectrum. And then we have disordered eating somewhere in the middle, maybe the middle, like 50 to 75%. And so we want to, that might still be impairing our child, and they still might need some assistance in getting out of that, but it doesn't mean that they need that clinical diagnosis of an eating disorder.
Right.
Yeah. So as far as, signs and symptoms of an eating disorder, there are many. An eating disorder honestly can overlap with other disorders because, number one, eating disorders extremely rarely occur in isolation. Over 95% of the time, someone who is struggling with an eating disorder will be struggling with some other comorbid or co-occurring mental health condition, whether that's an anxiety disorder, depression, OCD, post-traumatic stress disorder, sleep disorders, bipolar. It could be any other mental health disorder. So it's not going to occur in isolation. And eating disorders really do affect all organs and systems of the body. So as I go through these signs and symptoms, just because your child maybe has one or two of them doesn't mean they have an eating disorder, right? But it might make someone think, okay, so now I have to start to think about what else I'm seeing emotionally or mentally with this child as well. So I think it's important to kind of contextualize what you're seeing and not just assume, oh, she said this and my daughter has this, then she must have an eating disorder, right?
Mm-hmm.
But I think it's important to note that less than 6% of people who actually struggle with an eating disorder are diagnosed as underweight. So you can't always expect to see someone who's struggling with an eating disorder. And people in larger bodies really are half as likely as those in what we call, I don't know, I guess normal weight bodies or underweight bodies to be diagnosed with an eating disorder. Okay, so what I would say first, of course, is that complete preoccupation with thoughts of food and eating calories and burning calories and weight and sizes of everybody else. Just that complete preoccupation in your brain would be one whole body kind of a sign or a symptom. And then there are a bunch of behavioral symptoms that could also be, mean that this person is struggling as well. Perhaps they started to now refuse to eat certain foods, or they're skipping meals when they weren't doing that before. They're only eating at certain times of day. They're very specific. I won't eat after 6 p.m. or I won't eat before 11 a.m. or whatever that looks like. They might be very uncomfortable eating around other people. You'll notice that they never want to eat around anybody else. They might develop some new food rituals or food practices. That could be, cutting their food into tiny pieces in order to eat it. Or, a lot of people dab their maybe pizza slice with a napkin before they eat it, but this is going to be more compulsive where every drop of oil has to be removed. There can't be any fat left. So it won't be just a little bit of dabbing. They might, a new food practice might be chewing very slowly, eating only in secret. You might find large amounts of food missing from your cabinet that they're stealing or taking to their bedroom and eating it and hiding the wrappers. They might be dieting all the time. You might notice that they comment a lot on other people's bodies and sizes and shapes. Any extreme fluctuation in somebody's weight, either a loss or a gain, can be indicative of an eating disorder. Somebody who checks their weight constantly, they're either weighing themselves several times a day or they're measuring their body fat, I don't know, they might use a tape measure, they might use their own hand around their wrist, just checking that a lot. Or they express, a tremendous fear of gaining weight. You might notice that they become more withdrawn from their friends and activities as they become more malnourished. They have less energy. They might experience extreme mood swings or start to feel disgusted with themselves. And gastrointestinally, usually people with an eating disorder struggle a lot because of either the starvation component of what's going on or the purging component or even the overeating component. Their digestion is kind of altered. And so this causes them to have bloating and pain with eating and nausea and acid reflux. So you might notice cramping, vomiting, things like that. And also they might struggle to concentrate or focus, again, because of the lack of nourishment. They might feel cold all the time or suffer from some sleep issues. They might start to either stop menstruating altogether or start menstruating less regularly. And then, of course, some physical symptoms might be constant mirror checking. Like you notice they always have to look in the mirror all the time. They're looking at themselves in the mirror. Or you're going to see that they're kind of dizzy, or they might kind of not necessarily faint, although some of them do faint. Many of them faint, but it doesn't have to be a faint to be a symptom. But they seem to, get that black. When they stand up, they get almost black out. They might have abnormal lab findings, right? They might have anemia or low thyroid function, low potassium, low white blood count, low red blood count. They might have dental issues, muscle weakness, lowered immunity. And anyone who has extreme exercise regimens or frequent bathroom trips, these would all be signs and symptoms that could indicate an eating disorder.
Okay. So that's a lot. That's a lot. And like you said, that it's all in context, right? It's like, you have to look at, maybe somebody has some of those, but not all of those.
Correct.
You and I actually started having a conversation at the end of I believe it was at the end of the conversation where we were like, okay, I think we're going to do this. This could be great. And somehow it came up that something that we need to, that it behooves us to talk about on an adulting podcast is when a parent is struggling with making difficult decisions about their child's care because of fear of, the unknown, because of fear of stigma, because they don't want to address it, and sort of like showing up for your kid in a way that's extremely uncomfortable in dealing with something that's so sensitive and so dangerous. And I think I don't know if you remember us talking about that, but can we talk about that for a little bit? Can we talk about the parents sort of going outside of their comfort zone and not just waiting for the kid to and making difficult decisions about the kid and their wellness?
Yeah, I mean, definitely it's scary and it's difficult. And I think one of the scariest pieces is, like we said, many of us struggle with our own body image issues. And so we don't really want to have this conversation with our kids because we don't want to put our hangups on them, right? We struggled ourselves. We still might struggle. And we don't want to say something that could, also show them, trigger them or put them in a worse place than they are right now. So sometimes we want to, and especially in adolescence, we want to tread lightly because they can be very it can be a hotbed time for them where they might get, over responsive to certain types of things that you might say or do. And so, yes, it's very understandable that it might be difficult conversations to have. I totally understand that, which is actually why I created this program beyond the book that I wrote. I actually created a curriculum for mothers and daughters to do together. And this curriculum kind of has 11 different units that will be on different things. And we can have these conversations around things that might be difficult for our mothers to talk about with their kids. And then it has exercises and talking points and journal entries and things like that they can do together with their child when it's something that's difficult for them to talk about.
Right. We discussed the larger, or let's say the notion that people are uncomfortable dealing with this issue because of all the different reasons, whatever they may be, and what kind of impact that has on the people around them. Like, I think people don't necessarily think about, what the consequences are if you ignore such a serious condition.
Yeah,
you told me about something that happened in Israel.
Yeah,
which I'm sure is not isolated. Can you talk to us a little bit more about that?
Well, I did hear about a situation in Israel where a girl had a diagnosed disorder and she had some treatment and her parents and her felt that she should still go to Israel. She wanted to get off all her medication that she was taking for her co-occurring issues that she was having in addition to, with her eating disorder. And they sent her to seminary without, letting the seminary know, informing the seminary that she has this eating disorder or these other issues. And very, very, very sadly, it got worse and she actually passed away. During davening, she collapsed and they were unable to revive her. And this obviously became traumatic, not only for her family, which I can't even imagine, but also for all the girls who witnessed this, that it wasn't, that maybe they didn't realize how serious it was, or maybe they felt that it was going to be stigmatizing for her to be coming to seminary as a girl with an eating disorder, but her physical and mental health really should have taken priority over that fear, because ultimately it was a very sad ending.
Right. And I think that's where the challenge is one of the challenges is having a difficult conversation, having the conversation when you yourself struggle is going to be difficult, because children, they know, do as I say, not as I do. Especially the teenagers, they know when we're being hypocrites. They know when we're worried about what people think about our bodies and whether we feel like we look fat. Like maybe we could hide it a little bit better from the little ones, but once they become teenagers, it is just that much more difficult to have that conversation. So not wanting to address it that way and wanting your kid to just be mainstream, not to have issues. Let's go to seminary. Let's get you off the medications because, it's going to be difficult to get the medications in Israel, and then the school has to know about it, and maybe they'll say no to you, and what's that going to do for shidduchim? And I mean, it is a very complicated place to be. You could almost, you could definitely find empathy in your heart for people in that situation, and yet it's so scary. It's so hard, and it's like I get why you're ignoring it, but you just can't.
Yeah. And I don't think people necessarily realize how dangerous and deadly eating disorders are, how the statistics, really show that they're very, very, they are this number two, they have the second highest mortality rate in adolescents, and they're second only behind drug overdoses. They're the second leading cause of mental health disability for adolescent girls and young women. One death every 52 minutes can be attributed directly to an eating disorder. People with eating disorders are 11 times more likely than the general population to attempt suicide. It is a very, very dangerous illness, and we can't, maybe the girl seems to look okay, but things have changed. I've seen things change very quickly, from appearing to be physically fine and then collapsing and having heart issues, liver issues, kidney issues. So I personally think that it's not that the parents, they might not be educated in this area to understand, what an eating disorder is and how dangerous this can be and what to look for. It can be, like you said, it can be stigmatizing. It can be really, really scary. I heard of another story recently. We were working to try to help this other girl who's struggling with a diagnosed eating disorder. She has anorexia, and her parents, for whatever reason, cannot accept it. They will not get her help. They don't believe she has it. They took her to, we asked them to take her to like a medical professional to be, to be looked over to make sure that she's safe to continue in school and to get therapy outside of the hospital. And they took her to a nurse practitioner. They didn't have any blood taken. The nurse practitioner, they said she doesn't have an eating disorder. And they're unable to recognize how significant this issue is. And we're all, very worried. I don't think anyone's doing this purposefully, but I think that it's a really hard thing in our community to recognize and to get help for. It's very stigmatized in our community.
Right. So I know that you're working with schools to help with the curriculum and trying to improve body positivity and everything like that. Can you tell me a little bit about, first of all, you said that this became sort of a passion of yours, and you told us a little bit about why at the beginning of this podcast. But tell me how the schools how they've changed over time, if they have, what kinds of programs you put in place, or what kind of education. How do you go about working with the schools who really are on the front line in many ways, because they're the ones who see your daughters skipping lunch, and they're the ones who see your daughters, they might be able to see it in an objective way. What have you seen, and what have you, been able to implement?
A great question. So a lot of schools are recognizing that, these are issues that they need to have these conversations about with the girls. When we do the curriculum in the schools, it's just important for everyone to understand that we never talk about eating disorders with the girls themselves. We talk about appearance, ideal body image. We're going to talk around a lot of other different types of topics. We're not going to introduce what an eating disorder is. Most of them know what it is. If they have questions, that's fine. But we're not talking about it because we're not triggering any behaviors. We're specifically planting the seeds for them to have new pathways of thought and how they think about certain messaging that we've been given and we have assumed to be truthful. So that's kind of one prong of the approach, really, is to work with the kids in the schools. Now, it's important, I like to tell the schools two things. Number one, eating disorders are manifest through food. Food is not the cause of the eating disorder. Rather, it's the way a person is, communicating what their issue is. They're taking control back in some way. Other people might have a different manifestation of the struggle that they're having. They might burn, cut. We're seeing a lot of that in the schools as well, substance use and abuse. So we don't our programs are not so myopic or focused only on appearance, ideal, and body image, because we want to give our girls a lot of skills and tools for their emotional and mental health so that they can feel comfortable and having certain conversations and in questioning things. And so this is very important to us that we have three different levels. That we have three different levels, level 1, 2, and 3, and that each one focuses on something a little bit different in the classroom. The second thing I like to tell the schools is that they give our girls good information. Baruch Hashem, they don't need me to give them more good information. They have that under control. What they actually need me for is to change the way the girls critically evaluate the messaging that they're getting. And like I said, create those new pathways of thought. It's like we're planting seeds in how they will now start to think about and interact with certain messaging and things that they've been taught or assumed to be truthful. And so that's one part of the approach that we take in how we help our girls. And that's really the empirical part, is the planting of the seeds. It's called kind of sowing seeds of cognitive dissonance in the girls. But everything that we do is based on Torah and Hashkafa, but it's also empirically based. And the second prong of the approach is the moms, because whether moms like to believe it or not, they really are the primary way a girl sees her body and herself. And they are going to need to get help for their own issues, or they're going to need to have a better understanding of how body image is created and how they can help their daughter. And the truth is I love mothers to understand that their influence is so profound. They impact their daughter's sense of self, her values, what she chooses to prioritize in her own life every single day. And studies show that girls really have a difficult time separating their own body from their mother's body until about the age of 8. So it's a lot of years before a girl can kind of take it on herself, her own body image. She's really caught up in her mother's body image from a very young age. And then, like you said, the final prong to the approach are the teachers themselves, because they are interacting with our girls on a day-to-day basis. And so it's really important that we have a seminar with the teachers on not only understanding what eating disorders are, but having a better sense of the signs and symptoms of them in case, chas v'shalom, they notice something in the classroom or in the school that this girl is having that somebody hasn't noticed at home, or the other girls in the class are coming to them with a concern, and they can know exactly what to do, what the protocol is. But also, it's really important that we create safe spaces in the classrooms for our students, because there's a lot of weight bias and stigma that we're seeing. Weight bullying is actually one of the most prevalent, it's the most prevalent form of bullying that we're seeing in the classroom. And in schools, in girls as young as first grade and from schools, they call me. I only speak to from schools. They're having girls making fun of other girls. You're fat, don't eat that, don't eat a hamburger, eat a salad. It's starting very young. So we need the teachers to not allow this kind of conversation, to create safe spaces in the classroom. And so that's part of what we do by speaking to the teachers. So it's really a three-pronged approach, because we want to hit all people who are so influential in this girl's life. And it doesn't leave off the fathers who, we definitely have some things with the parent presentation. Some schools choose to do it as a parent presentation. Some schools choose to do it as a mother presentation. It's really just based on the school and their comfort level. But we definitely also, want to talk to fathers about how they speak to their daughters as well.
Right. So actually, that's a good segue to something that I've been thinking about, which is disordered eating with young men, with our boys in yeshivas and so forth. How prevalent of a problem is that? And what trends are you seeing in this regard, if any?
Yeah. So general numbers show that, women and girls are 2 times more likely to struggle with an eating disorder than men and boys. That said, since the onset of COVID, even October 7, we're seeing an increase in boys who are struggling. Their struggles might be a little bit different and might be more about muscularity versus thinness. Their mindset is a little bit different, but we are definitely seeing struggles. And like you said, the yeshiva schedule, the yeshiva food kind of lends itself to some type of disordered eating practices. And there are a lot of mothers with concerns about their boys in yeshiva because they don't really, from a pretty young age, they don't necessarily have a say in what their child's eating anymore, or they don't get to serve their child, this nutritious food all the time. And sometimes they're making choices that they think are not in their best, health interests. So it's definitely a struggle.
Right. I mean, It's hard for me to envision like a yeshiva bacher even being noticed. Most of the time, the boys are pretty autonomous. Like if I'm thinking base medrash, and they're kind of left independently in ways that, let's say, girl teachers are not. And so I could see it becoming like falling below the radar more times than not. And I know that it's hard to get statistics and data on Orthodox friends and habits, right?
Absolutely. We're very, insular people. We don't like a lot of empirical study of ourselves overall. So, there are definitely studies that are conducted within our community that might not be, peer reviewed or put in a journal necessarily, but there are a lot of valuable studies. There haven't been a ton on eating disorders, but definitely from the anecdotal evidence that I hear, and the reading that I've done and seen, it's a growing issue with our boys. And I think it isn't just in base medrash. I think also in Masifta, they're there a lot of hours of the day, and they're given a lot of maybe independence, and that no one is watching them, obviously, during mealtime or to see if there's a change in their behaviors or what they're doing. And some of them might dorm, some of them might come home very late at night and either eat when they get home because they didn't eat dinner, because they didn't like dinner, then they're eating a lot very late at night, or, mothers want to pack them their food. I think there's a lot of different components to it as well. But yeah, it's definitely a problem.
Yeah. So talking now about successfully dealing with the issue, I'm imagining that, just like any protocol, any educational system and coping mechanisms that are put in play to try to handle and deal with. Can you tell me any either anecdotal or research that has shown that, that the way that people address it can make such a big impact and have successfully, and maybe tell us about a time that it definitely worked or definitely didn't?
Well, we do know that, early treatment is the most successful treatment. So the earlier your child gets diagnosed and or treated for an eating disorder, there is tons of research on how much more effective the treatment is, how the rates of relapse and problems again and again are much less when people get treatment early on by experienced professionals, right? It can't be, a lot of times people will say, my child has anxiety and they're diagnosed with an eating disorder, can they go to somebody for their anxiety and then go to somebody else for their eating disorder? Or can we just, treat the anxiety and that will help with the eating disorder? We really do need to recognize that eating disorder treatment given by trained and experienced therapists or specialists is far more effective and successful. So it's, we have to kind of do both as early on and from the right types of professionals. I think that's, the key. Sorry, what was the second part?
The second part was if you have any anecdotes or
Right.
data points that show that, a time where somebody was either treated successfully or unsuccessfully, and what were the factors that led to that?
So a lot of times people, will share with me that sadly, the mother will see that something is going on with their child and they will take them to the doctor. And then the doctor will say, well, she's not that thin, or she hasn't lost that much weight, and this is just part of puberty and everything's fine. One that sticks out in my mind was particularly sad was like a girl who was 12 years old, and her mom said, she had been through a rough divorce a couple of years before, and the girl, kept restricting her eating, and the mom noticed that she was losing weight, and she took her to the doctor. The doctor said she was fine. They went back a few months later. She's really fine. Don't worry. A few months later, the fourth time they went back, which is about a year after she started to notice the behaviors, she was already significantly having issues with her heart. Her electrolytes were off balance. She was struggling with her liver was having issues. And so actually she needed to, her heart rate was so low, they needed to hospitalize her immediately. And that was kind of a sad story because she was hospitalized and then she came out of the hospital and had to be sent in again and then again. And if the doctor would have listened to the mom who knew her daughter better than anybody else, then it could have been that she would have gotten treatment right away a year before, and we wouldn't be in the same situation that we were seeing now. And that's why I really love parents to be really proactive. If they are concerned that there could be an issue, be proactive. It's worth it. Even if they say, listen, she's struggling with really disordered eating. It's not an eating disorder, but let's get her help so that it doesn't develop into an eating disorder. That's worst case scenario. And if it's an eating disorder, that's best case scenario. But if it's an eating disorder, then she can use all the help she can get as soon as possible. The younger they are, the easier it is to change, their behaviors. Another mother shared with me about her daughter who was her whole life, she was just not on the same growth chart as the rest of her siblings. She was always very uncomfortable around food, didn't enjoy eating, didn't want to eat, had a lot of fear of foods. And it wasn't until she was 18 years old that she was finally diagnosed with ARFID, which was that one we talked about, avoidant restrictive food intake disorder. Which kind of can be characterized, I guess, as extreme picky eating. But these people are malnourished, and she was really ill by the time they actually were able to diagnose her. But when kids get the diagnosis younger, they actually can go to occupational therapists and get help with textures and temperatures, and they really have a much higher success the earlier that they are treated. So it really behooves us to notice any change in our kids' behaviors. And I think it's hard during the school year because oftentimes I feel like they're in school more than they're at home. They're sleeping at home, but their wake hours are often when they're in school or at their friend's house studying. And that's why the teachers can be such an important part of this as well, as can the friends. Often the friends are the ones who might notice something going on with a friend of theirs. But the earlier we notice any changes in their behaviors that are not just normal adolescent changes, the better off we are in helping them long term.
Right. So basically what I'm thinking is, now it takes having to trust yourself and say, because I think a lot of times as mothers, we second guess ourselves. Maybe we listen a little too much and a little too closely to the quote unquote subject matter experts. And there are so many times, I don't know if it's a data point or if it's anecdotal, where parents know their child, they know there's something wrong, and the professional is like, no, it's fine, no, it's fine. And a parent who listens to their gut and pushes forward oftentimes will reap the benefit of that, because your motherly instinct is not to be underscored. I mean, like you said, the mothers know the child better. They know that it's a problem. They know how much of an issue it's causing. You need to really sort of trust yourself.
Totally agree with you. I trust your parental instincts. Hashem blessed you with this child. You know them better than anyone else knows them. I think it's really important. I think sometimes parents inadvertently get stuck in blame, if my child's having this issue, it must be my fault. And then sometimes it's hard for us to move forward. So I think it's important for them to understand there are so many factors that go into a struggle like this that there's no constructive point in blaming anybody. It's no one thing that caused, this situation. And it's really important to ask questions and educate yourself. This is, you're your child's advocate, and that's your job. So ask the questions, educate yourself. And I really do advise parents to seek support for themselves, because an eating disorder recovery process can be an arduous, difficult process. And sometimes the parents will need a little bit of their own support throughout, because their child, I like to remind them, what happens during an eating disorder is oftentimes the child has what we call like an eating disorder voice, which is really, I compare it to a Yetzer Hara in that it's not so clear that it's telling you to do something negative. It knows exactly how to talk you into doing some of these negative behaviors, and you don't realize that it's actually controlling you. And even when the child wants to get better, the voice is telling them, you're not worthy if you don't lose more weight. If you eat this, you're a terrible person. You're a loser. You have no self-control. And so, it's really important that the parent also gets that support for themselves as they go through this, because their child might not be as their regular child during this process. The malnourishment piece does really make cognitive, mental deficits in the child during the process.
Right. So I'm cognizant of the time that we're spending, and I think that this is one of those topics that really can be delved, and we could just keep talking about it, but we just don't have the time. So it's important that people pick up your book and read it and get a better sense of what can be done and what kind of strategies. But for today, could you tell our listeners maybe one or two things that you would recommend to start? to just sort of, something that we can do today that can help us, figure out whether this is where we need to be or what we need to do next. Like just any advice just for, starting off before the book comes in the mail.
Right. So, I mean, I would say any change that you're noticing in your child is something for you to take note of and to see how severe it is and significant. Any kind of change. Obviously, adolescents have a lot of change going on, but really kind of notice: are they withdrawing? Are they behaving socially differently? Are their academics suffering or changing in any way? Are they changing habits? Are they, cooking for everybody but not eating themselves? I would really try to take note of what your child is saying and doing, and if that's different than what they've done in the past in any way. Are they exercising, moving their life all the time, constantly? They never want to sit still because they always want to be burning calories. Any real big change in their behavior would be something to just take note of and see if you felt like that was impairing them long term. And really just a couple things that we can work on today that don't have to necessarily be eating disorder related is, like we talked about, those externals. We want to stop focusing on our externals as much as we want to focus on our mitos, our talents, our capabilities, our abilities, talking to our kids about what's really important and complimenting them on the right things. Reminding them that our bodies are gifts from Hashem. They are what carry our neshama in this world, and Hashem gave them to us, and we have to be careful how we take care of them and how we treat them. We know that the Rambam in Hilchos Deos says that maintaining a healthy and whole body is actually an integral part of our divine service. So helping them understand the true value of our physical bodies. And of course, solidifying a good relationship for our child with food, food being fuel, food being nourishment, food being sustenance, not using food as a reward or a punishment, not judging food as good or bad food. Certainly some foods are more nourishing than other foods, but they're not bad foods or garbage, because then why do you feed your child garbage sometimes, or why do people eat garbage? No, it might not be a nourishing food. It might be more of a fun food, but it's something that we do, on occasion, because food is more than the ingredients on the plate, or the items on the plate. It's really how it's blended into moments of celebration, of simcha, of family ritual, of Yom Tovim, of Shabbos. So we really don't want to make food out to be the enemy. And I think those would be three, great things to think about moving forward. There are lots more things and more detail on them, but things to look at in your child and things we can do kind of moving forward.
Yeah, and I think that kol hakavod for getting all that in such a short period of time, because I know oftentimes I ask a lot of the people that I interview, and I'm like, I know we're only going to have a short time together, but we're going to see what we can get to. And you were able to cover quite a bit. So thank you so much for your time. So I will put the link if anybody wants to visit your website. You're marcyforta.com, right?
And our Atzmi one is, atzmi.org. Yeah, that's my personal website.
Okay. And Atzmi is an organization that focuses on developing this curriculum for girls and our mothers and parents for helping with body image, right? Wonderful. Yep. Thank you so much for all the good work that you do and for joining me. And, I look forward to hearing more from you. Thank you so much.
Thank you.
Okay. Good night. Views expressed by me, your host, and my delightful guest are not necessarily reflective of each other's views, ideas, or life choices. Sometimes we're on the same page and other times we're not.